Okay. Some logistics before we get into content today. Your lab practical is on Tuesday next week. It is you're responsible for content that is in your lab packet. There will be 20 stations. You will rotate through each station. You have 1 minute at each station initially. You'll rotate through after time ends. You will then get 5 minutes at the end to go back to questions you may have missed, may want to go over again. When you initially arrive, the door will be locked, the blinds will be drawn. You can't talk during the exam. I will give you all an answer sheet with terms listed on the top. Each station will have its specific number and a question. When, let's say I have a bone or a model or something on the table, you cannot touch it. It's for the benefit of your fellow students. That's what I got. Any other questions about the exam? All right. Let's get into the axial skeleton. So the axial skeleton, we can break the body up into two categories we can break the skeletal system up into two different categories: axial and appendicular skeleton. Axial is going to be the head, the spine, the ribs, and our sacrum. And then appendicular, think appendages, our hips, shoulders, elbows, wrists, ankle, knee, all that good stuff. So we can see here on these, all of this in here is, let's undo that. All of this in here is axial skeleton, or excuse me, appendicular skeleton. And all of this in here is axial skeleton. And so part of that is how anatomists divide it, and we will first, we're first going to go over the axial skeleton. So there are, we'll start with, we're going top to bottom. Make sure that's right. Roughly top to bottom. And on the skull, there are a number of features that you need to know. So first, I'm going to start you off with big bones. So we have a couple of different bones. First one is this big one, our jaw bone, right in here. The proper name for our jawbone is going to be, where? Proper name for it is maxilla, M-A-X-I-L-L-A. And then we have, did they not give me these? Then we have the Gosh darn it. Where did it go? Maxilla, and then the other structure. Maxilla, it has a couple of different parts. We'll get to those eventually. But what you also need to know, so the second bone that we're looking at here is the right in here in the middle. That is our vomer. We'll label that here, vomer. That is the bony part of your nose. So if you break your nose, that is the small delicate bone. It's quite easy to break that. And when I have a patient, say, who I suspect of having a fracture in their nose, oftentimes if you have actually fractured your nose, there's quite a bit of blood. There's typically you'll hear the vomer actually snap, and there's quite a bit of blood that comes out. So I've had patients a handful of times where they'll say, "Oh, I think I broke my nose," and when I look up their nose, and when they present to me, they're not bleeding, they're not doing anything, and it's highly unlikely that they broke their nose. Then we have this other bone right in here, change color. Right in here, this bone up in here, it's two separate bones. It's part of your, actually, oh my gosh, hold on. Maxilla, I completely labeled that wrong. This is not the maxilla. This is the mandible. This bone here is the maxilla. Can you tell I didn't sleep a lot last night? So maxilla, the top kind of below your most prominent areas of your cheeks. Both the mandible and maxilla have joints in them. Your teeth, your alveolar joints, for all of your teeth. I'll say interesting thing about the mandible is that because of its location and because of how it articulates with the rest of the skull, one presentation that can happen quite frequently in patients is TMJ pain, so temporomandibular joint. We'll see that on the next view, on the lateral view. You can also have patients who kind of dislocate their mandible or their jaw, and those are always fun ones to relocate. I have not had that happen in a patient, thankfully, but I have known other athletic trainers who have. And then moving on, we have another bone right here. I'm going to outline this one in red. This one right here, you can see on this front view. And coming over here, this bone right here. So this bone is part of, or makes up part of, this kind of whole big space where your eye sits is called the orbit. And this inferior portion that's just lateral to the maxilla. Do we have it? No. Just lateral, excuse me, to the maxilla is the zygomatic bone. So the orbit's kind of the whole space, and then it is made up of the border of the orbit on the front side is made up of different bones. So the first one is the maxilla. The second one we're talking about is the zygomatic bone on the front side. So if you feel, is it the same as the cheekbone? If you feel in front, before you kind of get this very prominent ridge, typically on your cheek right here, right next to your nose, that's going to be the maxilla. But then right when you get to kind of the prominent part is going to be around that area. If we take a precision eraser right here, so you can see, if we zoom in, there's this bony joint right here, this hard joint, immovable joint. So it depends where you're pushing on, but your quote unquote cheekbone is made up of multiple bones depending on what area you're pushing on. Does that make sense? All right. All right. We got orbic, we got zygomatic bone, maxilla, mandible, vomer. Then we also have, no, I'm not going to make you know that one. Then we also have this big one in the front. This one's a real doozy of a one. It's the frontal bone. Frontal bone. So that frontal bone making up about that last third of the orbit, that superior portion of the orbit. So right up here on both sides. Frontal bone. Big, broad bone, forehead. It's one of the kind of major bones in the skull. And we can also see peaking on the sides right here is the temporal bone. Oh, that's too thick. Temporal bone. You can think of it as bone near your temples. Broad. You can see a much better view on the lateral side. And then there's a couple of other different terms or structures on these bones that I would like you to know. So the first one is going to be, remember when we're talking about bones, they have a body and a shaft. And so what I want you to know is the mandible, it has body. That's what that's pointing to. And we also have on the mandible something called the mental foramen. Mental foramen, that's going to be where we have nerve supply coming out from cranial nerves and serving some structures in. So one portion of the nerve will break off and serve teeth, and inside the cheek, another portion will serve kind of outside musculature, sensation, that kind of stuff. So on the mandible, we have a couple of the terms that I'm going to hold you accountable for: the body, the mental foramen, and then one of the last ones, two more, the ramus of the mandible. The ramus, you can see this a little bit better on the lateral view, but the ramus is we think about the mandible. I go over here for a minute. It's kind of flat and then it angles up, right? We have that upward angle in the back. And so the area in which it turns up is going to be the ramus. So it's just, I'll show you on the more lateral view, but the body is going to be more more in the transverse plane, and the ramus is going to be more in the sagittal plane. Mandible, ramus, mental foramen, body. All right, and then we also have another hole, another foramen. I'm going to move the maxilla. Okay. So these two holes that are just inferior to the orbit, these are the infraorbital foramen. These holes, these foramen, similar to the mental foramen in the mandible, come out with nerve supply, serve the face, just inferior to the eye, sensation and motor. All right, and what else did I want? I think that is going to be it for this anterior view of the skull. So we got the temporal bone, our temples, we got the orbit, we got the zygomatic bone, infraorbital foramen, maxilla, vomer, frontal bone, our skull. And then on the mandible, we have the ramus, mental foramen, and the body. Any questions on these structures? Yes, it is in the maxilla bone, but it's just, we just haven't termed it in relation to the maxilla. We termed it in relation to the orbit instead. Decision was made long ago. Any other questions? All right. And then if you wanted, here's the full filled out one. Highlight the terms that you are responsible for. That's just maxilla, orbital foramen, and vomer, and nasal bone. Oh, no, not that one. And frontal bone, and orbit, temporal bone, zygomatic bone. Is that it? Vomer bone, bone. Maxilla, frontal bone, zygomatic bone, temporal bone, frontal bone. All right, I think that's it. All right, now we're moving on the lateral side. We can see more of the bones that make up the skull. So once again, Roz, you want to tell me what this bone is in the front right here? In the front. In the front, what bone? There we go, frontal bone. So we have our frontal bone. And then we also have the ramus right here. This line right there. We have mental foramen. We also have right in here, down here is the body. And then kind of right when you get right about here on this posterior portion of this highlighter line right here, that's going to be more of the ramus, versus everything more anterior to that line is going to be more of the body. So I'm not going to label, when we test you on these structures in your next lab practical, I'm not going to put a label like, I'm not going to put a label like right here on this line. I'm not going to do that. It's going to be over here, over here. It'll be quite obvious. Should be quite obvious. Not here to trick you. So we got mental foramen, ramus. We have the frontal bone. We have the temporal bone right here. We also have the parietal, this one kind of in the back, the big one in the back. It's your parietal bone. You have both right and left parietal bones. And then you have a couple other structures that I want you to know. So this suture right here, for this joint right here, what plane, Chloe, might that suture be? This one right in the middle right here, this joint right here. Yeah, the joint that I've highlighted right there. What plane is that joint going to be in? Is going to be in the transverse plane. Planes of the body, right? We have three planes: coronal, sagittal, and transverse. Which plane does this joint look like it's on? Can you give me an answer? You're going to guess, or you're going to sit here all day? Give me a guess. Yeah, it's going to be in the coronal plane. remember the coronal plane kind of comes down, slices you front and back, like Parker, you gave us that example, front and back on coronal plane last time. So it's in the coronal plane, and it just so happens to be called the coronal suture. So temporal, parietal bone, we have the coronal suture. And we also have here, you can label again, a zygomatic bone right here. Right, that zygomatic bone. And then we have the temporal bone. It sneaks out all the way there. And you can see its suture right here as it articulates with the other bones and sneaks up into there. So this is all temporal bone. And then there is this joint, this connection between the temporal and the zygomatic bone. We call so let's see, let's put this in a different color. I'll do pink. So the zygomatic arch. So I'll also bring this out here. Zygomatic arch. And then a hole or foramen that goes through the temporal bone where you're able to hear, where we have the ability to hear. This hole right here, we can see it kind of looks just inferior to that zygomatic arch as it comes back to the temporal bone. It is called the external acoustic meatus. And it serves the purpose of allowing those nerves get back into our head in order for our brain to interpret hearing. It's a good reference point for you, kind of where your ear roughly lies on this skull. Another process that's around here is the mastoid process. So this large, it's not necessarily super large, but this process right here is the mastoid process. The way that I remember how to feel this, so if you go just behind your ear and just down a little bit, you can feel that mastoid process on your skull. So on me, it's kind of just behind where I might attach a earring, and I just go back just down a little bit, and you can feel that mastoid process. When we get into muscles, we'll talk about this, but if you rotate your neck to one side or another, there's a muscle that comes from your mastoid process all the way to your sternum. And that muscle, if you turn real sharply, you can kind of feel that muscle. And that is the sternocleidomastoid process. So it's named for its muscular attachments: sternum, clavicle, mastoid, sternocleidomastoid. Don't need to know that one right now. Just think mastoid process, kind of right behind your ear, external acoustic meatus. One other process that I want you all to know, here, this sharp one right here, you can see it sticking out kind of like a dagger. That is the styloid process. Styloid process has attachments for has attachments for, serves as an attachment point, excuse me, for some of the structures that are in your throat and your neck muscles. Your styloid process. And then can't see the vomer on this one, but what you can see is a little bit better on this view. This bone that's just kind of behind that makes up part of the orbit-ish adjacent to it. This bone right back in here. This is the sphenoid bone. Sphenoid bone, S-P-H-E-N-O-I-D. And right, it's just another bone. And then the last large bone that I'm gonna have you all know is your occipital bone. And that one is, let's change this color, is back here, your occipital bone. So in your back, you can feel kind of that big occipital bony process in the back of your skull, your occipital bone. These all have sutures associated with them. The only suture or joint, immovable joint, that you need to know on this view is that coronal suture. We will have one more suture that you need to know. All right, let's take 5 minutes here, okay? Come back at 10:07. Okay, now that you have the skulls with you, so we're looking at it in this view right here. And we want to take a look at a couple of different structures. So the first one I would look at is same size. All right. First structure, this large hole. It's another foramen. Well, cannot erase. It's quite dark. Another foramen. And is called the foramen magnum. It's where your spinal cord goes through, goes into your skull. And it's quite important for you to be able to see. Next one I'm going over, there are some condyles right next to the foramen magnum on either side. These are where the top of your spine or the two cervical vertebrae that articulate, or two, or at least one. So where the first cervical vertebrae articulates with your skull. So those smooth condyles, if we're looking at the face, it's more on the anterior side of that foramen magnum. These are the occipital condyles. That's a highlighter, not a pen. Occipital condyles. Then let's make sure we can get our other bones here. So we have our occipital bone. We have the zygomatic arch. We have the maxilla right in here. Maxilla right there. And one thing that you can see on this inferior view that you can't see on a superior or more lateral view is, Bree, you want to guess what this is right here? This area that I'm highlighting. What is that area called? So this area, the roof of your mouth. Yeah, your palate. That's palate, also known as hard palate. You do have a hard palate and a soft palate. We may get to that. Don't worry about that right now. Just know it's hard palate or palate. See the maxilla. Hard palate, zygomatic arch. We have the temporal bone that we can see right here. Comes this way and up over here. Temporal bone. We also have this one over here, our styloid process. We have the mastoid process. We have our occipital condyles, foramen magnum, occipital bone, hard palate. Zygomatic arch. Yep, I think that's it for this bottom view. Oh, one more I want to introduce. So where the mandible articulates with the skull, we also have a fossa, so a depressed area. We're gonna have to erase this here. Let's put temporal bone on the other side. So we'll draw temporal bone on the other side. Along with this one. Temporal bone. So we have, let's zoom in here on the temporal bone once again. We have this little fossa right here. This is the mandibular fossa. And the mandibular fossa is where the joint that is created in that space is the temporomandibular joint. So stemming from the temporal bone, the mandible, temporomandibular joint. I'll write that up here on this side. Temporomandibular joint. Temporomandibular joint. So we have the maxilla, the hard palate, which is on a part of the maxilla, hard palate, which is part of the maxilla. We have the temporal bone, and on the temporal bone, or on the temporal bone, a feature, the mandibular fossa. We also have, as part of the temporal bone, it articulates with the zygomatic bone. Here. It's always good. That's why I wanted this colored skull. Okay, fly. Come here. Got it. Zygomatic arch. Zygomatic bone. Zygomatic arch, which is the result of the zygomatic bone and the temporal bone, making that arch. Mandibular fossa, styloid process, occipital condyles, where the first cervical vertebrae articulates with the skull, the occipital bone in the back, your foramen magnum, where your spinal cord goes through, mastoid process, your temporal bone. Those are the features on the underside or inferior portion of the skull that I want you to know. The temporomandibular joint. So the temporomandibular joint is the joint that is created from the mandibular fossa and from the mandible. So we can look at it here in this lateral view. The joint's right there, right there. And so what I want you to think about, so I'm going to go back up to this lateral view right here. Yes. Yeah. Yep. Those are the occipital condyles. Yep. The zygomatic arch. So Theo, you want to take a stab at why we might need that zygomatic arch right there. Okay, let's see if I can get you there. There's a view where you can kind of see both views. Yes, you're getting there, close. What? No, it's a hard question to answer. Parker, do you want to take a stab at why we might have zygomatic arch? Theo kind of has you pointed in the right direction, where there's something about attachment, maybe some movement. Provides support, veering a little bit, not necessarily in the direction. Yeah, Theo stole what I was going to give to Tim. So the muscle, the reason why we have this zygomatic arch, the muscle that attaches onto your mandible and what allows you to open and close, right? If we feel right around our temples, you open and close your mouth, you can feel that muscle right there. And so the muscle kind of has a broad, we'll get into this, but it has a broad origin on the temporal bone and it inserts onto the ramus and it allows you or helps you close your mouth. By relaxing, it helps you open. When it contracts, helps you close that tight. So we're pulling in this direction. Yeah, so that's why we need that zygomatic arch. Foramen magnum, we need it to allow our brain and our spinal cord continuity. Occipital condyles allow us to move our head, nod back and forth, up and down. Mandibular fossa allows that free movement of the temporomandibular joint, right? Part of that temporomandibular joint. Yeah, that's what we got there. All right. Here's some, here's the fully labeled one. I've highlighted the structures that we've went over. Last view, this posterior view now. Like looking at these structures. So, Tim, we have another suture here, the second suture that I want you all to know. It's right here on the top. What plane is that suture in? So if it's in the sagittal plane, what suture is it going to be? There you go. Sagittal suture. Sag. Sagittal suture. Then we have on either side our parietal bones. Parietal bones. We have occipital bone. Isabel, you want to tell me what this big one is right here? What bone is this? Mandible. Mandible. We have Michaela peeking out just up under here. These right here, what might these be? They're condyles. Yep. So looking from the back, occipital condyles. Kimmy, you want to tell me what this spiky one is right here? Yep, the styloid process. Roz, you want to tell me what this structure is right here? Mastoid process, yep. Oh, that's an eraser. Chloe, you want to tell me what bone is this bone right here that's poking out? Mastoid process is on it, or one of the processes that is on it. Yep, the temporal bone. Let's see. Got the condyles. Ms. Powell, you want to tell me what is this structure right here? Yep, the palate. Bree just peeking out. We can barely see it. We'll zoom in just a little bit. This one right here. We mentioned it in the anterior view. That little bone right there in the middle of your nose that breaks when you break your nose. The vomer, yes, thank you. Say with your chest. Vomer. Sagittal suture. I'm gonna be mean. I'm gonna give you one more suture. This suture right here, that is the joint between the occipital bone and the parietal bone. This is the lambdoid suture. No, I'm not going to be mean. I didn't hold last year's class to that. I'm not going to hold you all to that. No, I'm not going to do that. Sagittal suture, coronal suture, the two sutures that I'm going to hold you accountable for. What's the last structure? Last one I'll hold you accountable for, quite prominent on this colored skull, is the external occipital protuberance. So that very bony, pointy part on the back part of your skull. This structure right here, external occipital protuberance. All right. Any questions on the structures that I'm holding you accountable for from this backside or the posterior side? I'm also going to label here the ramus. All right. Labeled one, sagittal suture, occipital bone, vomer, occipital condyle, palatine, ramus, axilla, mandible, styloid process, mastoid process, external occipital protuberance, temporal bone, parietal bone. All right. Any questions on any of the stuff that we went over today? Isabel. So the vomer, when we look inside, you can see that it's just right in the middle. So it's what I think of is it's kind of where cartilage in your nose kind of builds off of to move anteriorly to help divide the right and left nostrils. And one of the reasons why it's so important when, say, a patient has a upper respiratory infection, for us to catch it so early and treat it is because you might be able to see, right, if you pick up the skull, if you have something in your throat or nose, how close is that to your skull? How close is that to your brain? The vessels that serve your upper respiratory system are a hop, skip, and a jump, really a hop just away from being able to cross into the blood supply that supplies your brain, jump into the tissue that supplies your brain, that surrounds your brain. And so that's the big risk when someone has an upper respiratory infection or an infection in their eye, in their nose, and maybe even in their mouth or teeth. The ease of access for pathogens into your meninges on your brain, into the covering on your brain is very short ways away. Any other questions on skull? I would encourage you, you'll take this class is until 40. Take a couple minutes, find some of these structures on the skull, and kind of learn where they are, learn where they're at on the different skulls. Look at each of the skulls, because I will use all of the skulls when you get tested on the axial skeleton. Right. You might prioritize studying for your lab practical that's on Tuesday, but just start to look at it, find what we talked about in class on the skulls, and you should be good. All right. Please give me until right before you leave. That'd be quite helpful.